for her concussion symptoms. So we want to talk about head and neck pain today and how chiropractic can help. I'm going to share with you my years of experience, what we do in the clinic. I'm going to talk about chiropractic adjustments and how they work. I'm going to talk about shockwave and laser, and even things like orthotics that we do in the clinic. So I have over 30 years of experience as a chiropractor. I'm on my 31st year now. I've done over 100,000 adjustments in the spine and the accessory joints to the spine, which includes the jaw joint, the TMJ, and then other areas like the shoulder, elbow, feet, wrists. Sometimes people don't know that chiropractic can help in these areas. I focus on the alignment of the spine and improving the nerve flow and the function of the spine. So it reduces symptoms, it improves the flexibility, and it prevents reoccurrences because we correct the posture of the area, the alignment and the posture. If you do have head and neck pain, it can be debilitating. It can cause symptoms in the area. It can also radiate to other areas, because if your head's out of alignment, let's say your neck is too far forward, it's going to cause the angle of the jaw to change, as one example. So you could get TMJ as a secondary symptom to misalignments of the neck and the head, the way the head's being carried. So really we want to look at the area as a whole, and we want to find out what's causing the symptoms that the patient has. And this can be a result of maybe a whiplash or a sports injury, and that can result in various types of symptoms. Or it's just poor posture, sleeping, sitting at the desk, your ergonomics, driving for long periods of time, even lifting, like a lot of nurses come to the clinic, or tradespeople like plumbers, electrician, that are in poor positions. The real life impact is poor sleep, poor concentration, low energy, affects your mood. It can result in things like things like being tired all the time, or getting depressed and losing hope about your health and what you can do down the road. It really affects what people love to do, whether it's working or golf or gardening or travel. They can't do what they love to do because of the symptoms. Some overlooked causes are posture and alignment, stress, and even screen time. So contributing factors can be these four items. It can cause nerve interference and muscle tension, and then reduce your nerve flow and blood flow in the area. So sometimes I find with the upper part of the spine being out of place, often that causes headaches or neck pain in the upper part that radiates upward. And if I find the lower part of the neck out of place, it usually causes pain in the lower neck, into the shoulders, the chest area, and down to the fingertips on both sides. So depends on where the misalignments are, and it depends on where the nerves go in that area. So we want to treat the cause of the problem, not the symptoms. Sometimes people have numbness and tingling in their hand, but it's really coming from their neck. And if we just treated the hand, the symptoms would not go away. So pain is a signal. It's not the problem itself. It's an indication that you should pay attention to that area and do something about it. It's like your body saying, hey, look at me, look at me. I need some help in this area. So I want you to understand each condition. TMJ is temporomandibular joint, and these disorders affect how the jaw works, the alignment of the jaw, and when the jaw is not opening and closing properly, when it's clicking because there's a disc in there, that can cause pain that radiates up into the head region, into the temple, can cause sharp pain in the jaw, and pain that radiates along the jawline. Whiplash is more of a rapid movement, front to back in the neck area. It can injure the back and the front side of the neck, and can cause problems like squished discs, pinched nerves. Concussions, that affects the brain itself, inside the skull, and when there's a whipping of the brain forward and back, it gets bruised. The brain can get bruised inside the skull, cause inflammation, and then the cerebral spinal fluid, which circulates around the brain and within the brain, then that is affected, and so is the nerve flow coming out of that area. And for headaches and migraines, has a lot to do with the alignment of the bones and the nerve flow going from the brain down the spinal cord and back up to the brain, as well as the circulation going through the area. There's carotid arteries, vertebral arteries. There's a lot of veins running through the area as well. You can see those there, and here's the arteries right here. Now, for chiropractic solutions for these symptoms, chiropractic restores the alignment and the mobility. The benefits are improved posture, reduced tension, restored nerve flow. It's safe and natural, no medication or surgery is required, and the improvement timeline can be days to weeks if it's recent, acute. If it's chronic, it can take longer. It can take weeks to months. So the phases are pain relief, correction, postural correction and alignment, and maintenance and prevention. People often say things like, I got my life back after years of having headaches. So, people will have these symptoms that are lingering for a long time, and eventually when they do come to the chiropractor, they get treatment and it really helps them. So the sooner the better. Actually, I had a patient this morning. She was in a car accident, her and her baby. They were rear-ended, and so they came into the clinic to get checked. And I said, the sooner the better, because we want to deal with the injuries when they're still fresh and not down the road when they become more chronic. We have advanced therapies like laser and shockwave that we use for these conditions. Laser therapy reduces inflammation, promotes tissue healing. It's light therapy, concentrated light that goes into the body. Shockwave therapy, sound waves. There's actually no shocks, but the machine creates sound waves that go into the body to break down scar tissue and stimulate recovery. And these two therapies, laser and shockwave, they complement chiropractic adjustments because they help the healing process, especially in the soft tissues. Chiropractic's good at realigning the bones and freeing up the nerves, but shockwave and laser really helps with the soft tissues. The people who benefit the most are patients who come in immediately after an injury, someone who's had an accident, somebody with chronic pain, athletes, and even people with concussions. They can benefit with this type of treatment for their spinal conditions. Now, there's a number of things you can do at home. One of the things I immediately advise people to do is to sleep on the pain-free side. So you want to avoid aggravating the condition or sleeping on the painful side, because that can cause more pressure on the nerves. I tell people to use ice initially for the first 3 days after they start care, and then I switch to heat generally after 72 hours. So heat will soften the muscle and tissue. Ice will reduce swelling. And then posture is very important. So as we start doing adjustments, giving the patient stretches and exercises to do at home, things they can do to maintain better posture, like wall angels against the wall. These are good things to do to maintain good posture, and depending on their condition, we give them specific stretches for their condition. Nutrition is important, getting enough protein. Hydration is important, getting enough water, just to give the tissues the right amount of nutrients to heal properly. And then movement and stretching are very important. We give out yoga type of stretches initially. Cat and cow are the two that I like to go to at the beginning, but also some increased movement. Going for a walk for 10, 15, 20 minutes can really help. So with chiropractic care, what we want to do is change your posture from a slouched forward posture like this, where there's misalignments, to one that you're more upright, where the ear, shoulder, hip, and the ankle are lined up, and right to left, everything is parallel. I want to thank you for joining me today for this webinar. If you want to come to our clinic here in Kelowna, we are accepting new patients. All you have to do is take out your phone and scan this QR code right here, and you will be able to book an appointment. Often we hold one appointment each day for a new patient, so sometimes you can get in the same day or the next day, and we can get started with your treatment immediately. Now, if you want to text us, you can certainly do that, or call us at this number, 250-486-0062, and we'd be happy to book an appointment for you. If you're not in the Kelowna area, what I'm offering is 3 different services to help you along. One is our mastermind group, where we will talk about stretches and exercises, posture, different head and neck conditions, and how chiropractic can help. And this is over a period of 4 weeks. So when people join, there's weekly sessions once a week for 4 weeks. You may need some one-on-one coaching, and for that we start with an initial strategy session to see how we can help you. Sometimes we'll refer you to a chiropractor in your area, and then continue on with recommendations for you to support your healing process. And that might involve sessions. Usually we sell a package of sessions, 13 sessions over 13 weeks, or 13 sessions over 26 weeks, over every second week, to help support you. And those sessions are done on Google Meet or Zoom. I prefer Google Meet because I find the technology works a little bit better. It's a little easier to use. So we have 100 seats available for the mastermind group. We have 10 coaching slots right now available for the one-on-one coaching. So to book your sessions, all you have to do is scan these QR codes again, or you can click on the link in the chat and you'll be able to book your online session. Thank you for joining me today. I really appreciate you being here and learning more about chiropractic care and how it can help. I hope to see you in the clinic or online soon.